associated assessments. And Richard can sort of give his own brief in a couple of minutes anyhow, all right? But what we're looking at, and I wanted to really jump in and do this intro part, was we are doing, I suppose, one reasonably kind of, I suppose, orthodox assessment, which is a computer test, test 1, or which happens on the 15th of September. And there's two major parts. I did post about this in Moodle, but just so that you know, there's two major parts to it. One is sectional radiographic anatomy, okay, which Richard will cover off in the remainder of this session. And in effect, that component of the test is largely built around this part that Richard's going to do today, all right? It's head, basically, brain and skull, all right? MR and CT images. And that's really it's a point and shoot component. It's a label to a structure, or there might be multiple labels and so on, but it's in effect labels. Can you identify the structure, right? Then the other component, it all runs in the same test, like, but the other component is anatomy of, again, the head, the brain, and skull. And you can imagine that you guys have covered anatomy in a lot more depth and had a lot more sessions on that up until now. So that component of the test will be, some of it will be point and shoot. There'll be a bone and you'll identify, you know, like wing of sphenoid or whatnot, but it'll also have more, starting to kind of have more complex questions in there. Multiple matching, closed responses, and so on, all right? So that's what that test looks like, but it's pretty straightforward. You're kind of used to that type of test, all right? The other item that we have done this year is, which was, again, was previously referred to as a Phillips portal activity, but we, like I posted before, we don't have Phillips portal anymore. We have a single via, which is an image viewer as well, all right? But I really wanted to just draw our attention to what that assessment looks like, so you guys can start wrapping your heads around it, because we have, and we have a couple of support workshops associated with that. The reason why, and again, I did speak to this in the unit intro, we are doing that is, I think we were finding Richard presents a lot of material here in the next hour and a half, and it can, there can be sometimes a failure to engage really deeply with that material, right? Because you get a whole lot of slides, and there is a lot of slides, and it's a lot of images and a lot of arrows, basically. So we've looked at going, how do we, going forward into year 3 particularly, how do we make sure people engage more deeply with that activity other than just a point and shoot type thing? So we've set up this other assignment. We've extended it from what they did last year. And if we go, I'll just share my Moodle real quickly, because I know Richard has a bit to get to, so I don't want to hold him up too long.
No, you're good. You're good.
Well, so if we look here, I think you guys should be able to see my Moodle page. Somebody give me a thumbs up. You can see my, yeah, cool. Thanks, Richard. Right. And underneath the assessment tab, right, here is, we have, like I said, what was previously referred to as Phillips portal exercise, but you're basically using single via now to support this activity, all right? But there's a workbook here, and if I open that, you guys should still see this. I've only left one page open because my plan is, what we find is, if we make workbooks or we make slides available for people before the activity, what people do is they basically, you know, and I'll be blunt, they get one person in their group to do the answers, and then they just share the answers with everybody else. All right? And I know that because I was a student myself once, and that's exactly what I would have done. Right? So we're looking at this now. Hopefully this will open, because I'm on Zoom, sometimes things slow down a bit. All right? And there's sort of, again, two components in this workbook. One is on the morning of the workshops, which are in your Moodle timetable, I will basically, the page will become available. Right. So in effect, you know, we've done the test, and then we'll have a workshop, and further down the way, we'll have done the lectures, and then we'll have the workshop. And we want to just come in, get into our little groups that you guys have assigned yourselves to, and basically go, what do we remember? What do we know? And that's just, can we label items, right? And in the workshop, that's what we will do. Right? And then we'll get somebody to present the responses. And that way we're forcing people to individually, or well, in little groups, engage with the material. okay? Rather than us going, well, can we do it separately and just submit, where I go, we know what happens. Sometimes it becomes a bit of a redundant exercise, right? And then, hopefully it's open now. The part, interesting, I made available for you guys in here was actually thorax, just to give you a vision of what it looks like. And some people have started doing it already. And I go, you don't have to, it's just so that I can show you sort of what it looks like, all right? Then the second component is where, if I come back to here, these instructions, what is, okay, good, that worked, right? Is where we'll be getting you, a bit like you're doing in the anatomy case study, is you'll be assigned a particular organ or a particular structure, and you basically have to present that anatomy. And that's where you would go to single via, and if, for example, it's like in, I don't know, the aorta, you go to single via, find the appropriate CT imaging. We're not going to be doing MR ones actually in that one, which will be, you know, not music to Richard's ear, because his MR special is his specialty, all right? But we're going CT is what we're setting people up for in year 3. And we want people to then, very briefly, you know, 2 to 3 minute video or series of slides, basically outline the radiographic anatomy of that structure and key surrounding structures. Right? Like if you're doing, I don't know, maybe somebody might have the like kidney, for example. Well, there'll be key surrounding structures like the psoas muscle, for example, and so on, that you'll see in close proximity to that. So in that way, we hope we're going from point and shoot of just recognizing and identifying anatomy to now coming along and going, well, now we're looking at a structure in its entirety. So we're not looking necessarily at single plane. We'll be looking at, well, show me one that shows its start position. If we talk about the aorta, you need one that has the root, one that shows the aortic arch at least, and in different planes, whichever one is most useful, and that shows it as it descends as well. And also then sort of surrounding structures. Where's the spine? How close is it? Where are the para-aortic structures and so on, right? But it'll only be one key structure for each of the groups. And then again, all of the areas will be covered across all the different groups. And it's about building really understanding is that these are 3-dimensional structures, and in cross-section, we're only seeing a component of it. All right, so we're really looking at then, hopefully from that point on, we really have a very good working knowledge of sectional radiographic anatomy, which is complex and there's lots to it. All right, does that make sense to everybody? I just wanted to literally just cover off those couple of points at the start. That's what I mentioned, you know, this was an intro to the assessments and so on associated as well. And again, we have workshops on the 3 main kind of areas that we'll be looking at: head and neck first, then it's I think spine and MSK, and then extremity and spine. Anyway, it's in the Moodle timetable. Cool. If there are not any questions, I'll let you guys go. Sorry, for some reason this is still not opening. Oh, that's because I didn't get it. Don't worry about that. It's just, so this is basically what, and again, I only made the thorax one available before the brain one. Brain will pop up here. And like I said, the first part of it is, well, can we identify this anatomy? And you're tapping your responses. All right. So again, we're moving beyond, all right? And then each person, you'll submit your mini presentations, really short, 2 to 3 minutes maximum, because it's just one structure to build capacity. Cool. Otherwise, the only other item is there is a session booked in for the case study on the 15th. I'll post about it, but it's also the morning of your exam. So we'll change that around, and we'll next week, where you're doing anatomy of the eye, Wendy and I will jump in the last 10 minutes and just speak to that assessment item as well. But these assessments are associated with sectional radiographic anatomy. Otherwise, I will leave you in Richard's capable hands. And thank you, Richard. Yeah, warm up there, everybody. Keep going. There's a good, go through. Thanks a million, Richard.
My pleasure, John. Thank you.
Jump out of here.
Okay, everyone. As John said, my name's Richard McIntyre. I'm a radiographer. I work at Monash Medical Centre and I do MRI. We have a lot to do with CT, obviously, so I'm quite happy with my knowledge there. Hopefully you will be too. I also work at Monash Medical Centre and Monash Biomedical Imaging. Okay, so I run the MRI machine over the road opposite the New Heart Hospital from the university. So we will be spending a lot of time together in the next year or two. I will be taking your cross-sectional anatomy of MR. Peter will be doing CT from now. I do MR and CT of the brain, and then Peter will do MR. Peter Kachira will do MR. We'll do CT of the other structures, and I will do MR of the other structures. Oh, I need a breath. And so obviously John's facilitating the thing. I think we'll get going. I've got a PowerPoint here that I like to share with you. I've got to change a couple of things. I've had a look at it and I've got to change a couple of things to make it more friendly for you guys. I originally developed this PowerPoint. I put together all the, actually, why don't I start from the top? I put together all the MR images. Peter very kindly, expertly put together all the CT images. So we've got together and shared those for you. And the other thing, can you, actually, I'm going to do this. Can you guys all see that? Can you see the full screen of cross-sectional anatomy, MRI Brain and CT?
Yep.
Yep.
Yep, and it's in a PowerPoint presentation. It's not, if I go through it, you don't see the slides on the sides, you just see the one picture?
Yep.
Yep, excellent. Okay, because what we'll be doing through this test, sorry, it's not a test. Whoa. What we'll be doing through this lecture is just going through, I'm going to get you to open up a little pad if it's on your workbook or if it's on your notes. We're going to do a little quizzes along the way, just so as it breaks up any monotony, okay? Because it is, as John said, there is a lot of structures. There's a lot of things to work to learn for this. So I just like to break up the monotony a little bit, have a bit of a quiz, get you to think, get me to have a little rest, and away we go. I will, as I say, I will share this slide because I want you to have the PowerPoint because it's easier to go through the structures than if you had PDF slides, okay? But I just have to, I got in trouble last time I presented this because the background was too dark and it was hard to print and some of the images were hard to see. So I'm going to reformat those. Meanwhile, I've done a little, and I want to reformat them in the Monash University format as well. So the learning outcomes for today is understand the anatomy and appearances of lobes and structures and their position within the brain. So we're going to build on what you know about your anatomy. I'm assuming you guys know a fair bit about your anatomy. You've done first year, you've done a little bit of second year brain anatomy. And the other part of it is to identify the lobes and structures of the brain on CT and MRI cross-sectional images. As far as I'm concerned, this is the main part of the lecture that we're doing today, okay? So you always need, one thing I'll always say with these lectures is you need to have a sound knowledge of anatomy, okay? And if you don't, you need to have an anatomy textbook with you, okay? It's very hard to try and identify structures on the brain and structures in these images that we'll be asking you to do if you don't know what structures are in the brain and what structures you'll expect to find, okay? The blood vessels as well are important, and also the cross-sectional images. So what we're going to do today is give you a very basic introduction to cross-sectional images, because I understand it can be intense and it can be hard to get your head around. And what I want you to do is be able to look at a cross-sectional image, see the type of, certainly the type of plane it's in, so axial, sagittal, coronal and oblique planes, and recognize the structures around it, okay? So you can identify the images, and you can identify the layout of the images, okay? We always have topograms and scanograms, so you can have a look at another image and you can see where that plane is on another image. But I'm hoping that you can identify where you are in an image. At the end of this section or this subject, you can have a look at an image and you can identify where you are, how you're positioned relative to the other anatomy, and certainly understand what plane you're looking at. And of course, we have different, what we call planes and weightings used CT and MRI, and filters and windows. So we'll be talking about those as well. So a lot to learn. First of all, we remember our anatomy. So we've got frontal lobe, temporal lobe, occipital lobe, parietal lobe, cerebellum, brainstem. And we've got lateral sulcus and central sulcus separating those lobes, okay? Oh, excuse me. And we also know, I try and, because this subject is so dry, I try and mix up a little bit of physiology with it as well. We have to understand that those different lobes perform different functions, okay? And they talk to each other. So it's always good just to know the functions that they control, okay? So we know frontal lobe is the prefrontal cortex, which operates a lot of our emotions, our cognitive thoughts. Temporal lobe also emotions, and with the amygdala, hippocampus stores our memory, parietal lobe does the movements, occipital lobe vision, cerebellum coordinates it all, and then it goes down the brainstem, okay? Right, now we get to some more interesting pictures. And we can see, what I usually do with these is, I'll start with the CSF, okay? So the CSF is born, it's generated in the choroid plexus, which is in the ventricles, okay? It's in the lateral ventricle, and it's in the third ventricle and the fourth ventricle, okay? So that secretes these areas secrete the CSF. The CSF secreted, and it goes into these lateral ventricles, okay? It travels down through the foramen of Monro, intraventricular foramen, okay? And then it's in the third ventricle. It travels down through the cerebral aqueduct to the fourth ventricle, okay? Then it travels down, or is made, and it travels down, and that CSF comes down, covers the spine, and covers the rest of the brain. So it all floats in CSF, okay? We don't want a dry brain. We have other things like we have the venous fluid movement, so we know the arteries come up. Obviously, whatever comes up goes down, so if the arteries come up, the blood is collected by the veins, and then superior sagittal sinus takes the veins back down, and from the middle down, and then the transverse sinus and the internal jugular veins, okay? We've got the occipital lobe, the parietal lobe, the frontal lobe. That's a midline sagittal, so we don't see the temporal lobes, the cerebellum, okay? We've got the structures, mesencephalic aqueduct, okay, or the cerebral aqueduct, okay, or the cerebral aqueduct through the mesencephaly. I think I've done that. So I think I've got another slide there which that shows the pia matter and the arachnoid matter. Or maybe we go through that in the spine. So, of course, everywhere there is CSF, we have subarachnoid space. Okay, so if CSF goes into an area, that's our subarachnoid space. Okay, and then, of course, central canal of the spinal canal, which is more or less a artery. Okay. Now we have an axial image, so we can see our grey matter. Okay, so this is where we're thinking. This is parts of the brain. This is the structures that we're using to think. And white matter. White matter is primarily composed of nervous tissue, of connective tissue. Okay, so we've got our grey matter where we use to think, and the signals are transferred through the white matter to the different areas in the grey matter. Okay, so that's essentially how the brain works. Now we've got a coronal image. Okay, so we'll go through all those structures, but one thing this coronal image shows us really well is the temporal lobes. Again, we've got these nerve tracts. Okay, we've got what's called the corpus callosum, so the nervous tracts pass from side to side. We've got the different structures there that we'll cover throughout the talk. There's nothing really that I want to, I need to focus on just yet. You can see those lateral ventricles that we were talking about, the choroid plexus inside, the third ventricle. Okay, so the interventricular foramen is the passage between the lateral ventricles and the third ventricles. Okay, and then we remember on our sagittal slide, we go from the third ventricles through the cerebral aqueduct to the fourth ventricle, and then the CSF travels down to wet to float the brain, float the spinal cord. Okay. Another thing we've got there is the pituitary gland with the dorsum sella, the bone around it. Okay. All right. So now we're going to talk about CT, and we're going to show you that CT is acquired in axial fashion. It's always acquired in axial. Okay. And we get one standard acquisition. Okay. So we can see there, this is one set of data. These two images come from one set of data. Okay, so the CT, the image is displayed with soft tissue windows. So we can see the soft tissue structures. Okay, we have exactly the same data. It's called a DICOM format, and you'll be using that a lot in your career. So all the image is created in one file called a DICOM format file, and then that file can be demonstrated in soft tissue windows, or it can be demonstrated in bony windows to show the bones. Okay, you can see there, even though these are different levels, you can see how that you don't see the bone very well there at all. Okay, you see the soft tissue very well, but you don't see the bone. Over here, you see the bone very well. Perfect. You don't see soft tissue. So if there's a bleed, unless it's obvious, or if it's got significantly different intensity, then you'll see it. But otherwise, you don't see it. Okay, but you'll see a fracture very, very well on CT. Okay. The other thing I mentioned too is any of my lectures, please feel free to stop me and ask questions. Okay, and we've also got blood windows or angio windows, so as we can see the blood vessels. Okay, so one set of data, different windows. We do have different filters as well, but I'm going to let that go to when you learn your CT. Okay, so we have different windows and filters, but we're just going to stick with windows for now. So that's all. And essentially we know that CT is made up of shadows. It's radiation. Okay, so we've used radiation to get these pictures. Now we're talking about MRI. We know that MRI doesn't use radiation. Okay, so as far as a utilization, as far as a image goes, it's very safe. We can scan anybody around, get them off the bus stop and bring them in and do a scan. All right. There's no radiation. It's all manipulation. In clinical, it's manipulation of hydrogen protons. Okay. So we have different, what we call weightings. We have T2 weightings. Okay. So you can see there the fluid is bright. So that CSF that we've talked about, that fluid is bright. Okay. So it stands out. These are poor resolution images, I'm afraid, but we'll get to good ones. And this is called a T1 weighted image. So this one, the fluid is dark. Okay. So the reason we have these two, and we have one more called proton density weighted images. Okay. And they're just a sort of a little mixture of them both, but we'll learn more of that in the coming lectures. So this is called pathology weighted images. Okay, so we have pathology. If we have a brain tumor, an infection, inflammation, the body sends fluid there, edema, blood. It sends it there to protect us. Okay, and if the fluid's bright as it is here, we're going to see those lesions more. Okay, it's going to be more sensitive. The image is going to be more sensitive to those lesions. Whereas on T1, we're not going to see fluid because fluid's dark. Okay, so this is pathology because we see the fluid. This is anatomy, okay, because we see the fat. Fat's often bright. All right, so we see the fat, we see the structures around a disease or around a normal brain, and we can say that's an anatomy weighted image. All right, so we have T1, which is anatomy, and T2, which is pathology. All right, very, very exciting, and you will come to love it. I know you will. T1 weighted image, so we have a sagittal image. We can see the fluid's dark. T2 weighted image, coronal image, the fluid's bright. Okay, that's just to complicate you at this stage of your learning. That's the case, but when you get to next year and the following year, you'll realize that that's actually not always the case. So you have to look at other things if you're going to determine the weighting. Okay, but at this stage, let's just concentrate on the fluid. So we have a coronal brain. Fat is bright, so you can see fat's bright by the subcutaneous fat. And you can see there, T1 fat is dark. Okay, so we've just done a manipulation. Both of these, water is dark. Okay, so we've just done a little manipulation of the image. Right. So now we're going to do some structures. Okay, only 30 minutes late. We're going to go from, we see an axial brain, and we go from the bottom of the brain to the top of the brain. Okay, so to orientate you, we've just gone above the teeth. Okay, so we've got the maxillary sinuses there, we've got the nose, we're just below the orbit, and we've cut the brain like a slough a slice of bread from the bottom to the top. Okay, see the cerebellum. So we're going, and the brainstem. We see the cerebellar hemisphere, so half of the sphere. Now we get into the temporal lobes. We see the cerebellum. Can you see the difference between the cerebellum and the occipital lobes? Okay, so you can see that, like, the texture, the difference in appearance of these two structures. And then, of course, we see the temporal lobes, which is part of the cerebrum. Okay, so we've got the cerebellum at the bottom, and we've got this, then we're coming up towards the cerebrum. Come up a little bit further, we have just the superior portion of the cerebellum, the spinal cord, the mesencephaly, or mesencephalic, temporal lobes, occipital lobes. Okay, and these are the sort of lobes that you've got to identify. We've got the Sylvian fissure, which separates the temporal lobes, the parietal lobes, and the frontal lobes. Okay, so that's a good landmark to learn, the Sylvian fissure. Parietal lobes, we're coming up towards the top of the brain, and of course we're doing the occipital lobes, which control vision. Okay, main function is to do vision. Now we're coming further up. We see that the CSF's dark, so we know that it's a T1 scan. Okay, we'll go through the structures in a minute, but at the moment we're looking at the frontal lobe, the parietal lobe, coming up towards the frontal lobe, parietal lobe where they meet. And then we can see the difference between the grey matter and the white matter. Okay, and there's a very good difference between those two on this type of image. Okay, so a T1 weighted image, the grey matter is dark and the white matter is bright. Okay, that's quite important. Okay, and then we come up. You can see with these images that you don't get a lot of information about the skull. This is subcutaneous skin or fat under our skin. Okay, and the skull is here. So MRI is not a great modality to look at bones in general. There's exceptions where we actually would do that, and it's always improving, but in general, MRI is not a great modality to look at bones. Okay, so now we're going to have a look at the same image, and we're going to have a look at the structures. We can see the intensity of the muscles, so the masseter muscle that helps you chew. The parotid gland, okay, so makes saliva. Okay, and you can see the structures in it. It's not just a gland, it's got tunnels and sinuses and structures to make the saliva and then secrete the saliva. Okay. Occipital condyle, we don't get a very good picture of the bones. Spinal cord, we get a lovely picture of the nervous tissue. And cisterna magna, which is essentially a space. Okay. So we come up, we're starting to get the sinuses. So we know nasopharynx is behind the nose. We've got the maxillary sinuses, which are ipsilateral to the nose. We've got our muscles. We've got our mandible, our coming up to the TMJ joint. Again, our salivary glands. Condyles. Condyles on MRI or bones on MRI are generally bright when they have fat in them. Okay, which makes sense because fat's bright on this weighting. Okay, whereas the cortex of bones don't have any fat in them. Okay, so we image hydrogen protons. They don't have any hydrogen in them, so they're dark. We've got our cerebellar tonsils. We've got the inferior aspect of the cerebellum, hemisphere, and again, we've got our cisterna magnum, or just our space. Coming up, tonsils, cerebellar tonsils. Medulla, so you might know that's the part of the brain, part of the spinal cord. Okay, just sitting under the pons. Pre-medullary cistern. So what does that mean? Oh. It means pre, which is in front of or before. The medullary, so the medullary is the medulla, and cistern means space. So pre-medullary cistern, pre-medulla space. All right. We've got a bone here called the clivus, okay, and we'll see that probably a little bit, get more of an understanding of that on the sagittal. We've got our zygomatic arch, we know is a bone, and we've got our maxillary sinus, okay, that we've gone through. Now we have a sphenoid sinus. So we've gone up above the nasopharynx, we've gone through the maxillary sinus, and we hit the sphenoid sinus, okay. I always remember the sphenoid sinus because they used to do what's called a transsphenoidal approach to get the pituitary gland out. Okay, so they'd always go across the sphenoid sinus. So I'd always remember that the sphenoid sinus is immediately in front of the pituitary gland. Pre-pontine cistern. So again, we know the pons pre, before. We've got the pons, auditory canal, okay. Fourth ventricle, we saw that on our initials diagrams, and left cerebellar hemisphere dirt. Okay, so what have we got here? Basis pontus, so, and pontine tegmentum, okay, so the parts of the pons, looking at an axial. Now we've got the hippocampus. So the hippocampus helps us with memory, and it's located in the temporal lobe. Okay. Hippocampus, from memory, is actually a seahorse. It's Greek for seahorse because it looks like a seahorse structure. And it's a sausage-like structure that lies in the middle of the temporal lobe. We've come across above our sphenoid sinus. So we've got our ethmoid sinus, we've got our optic nerve, and we've got our lens of the eye. Easy marks. Upper fourth ventricle. Falx cerebri, we know that's a layer of meninges separating the left and the right hemisphere. Easy marks. Globe of the eye, easy marks. Oh, I've gone back. So now we have crista gilli, which is a little eminence from the, I'm pretty sure it's from the maxilla bone. Okay. Falx cerebri, again, we've got that covering. There's the Sylvian fissure that separates the lobes. All right. One structure that we learn, certainly when you get into MRI and you do your scanning, you're going to know the anterior commissure and you're going to know the posterior commissure. Okay, so they're crossovers, they're nervous tracts that send signals from one side of the brain to the other side of the brain. And we align those up when we do our MRI. So you'll always see, or you should always see, those two structures on one image. Okay, and that's our standard presentation for the MRI of the brain. We've got third ventricle in the middle, so our little space we saw earlier in the third ventricle of CSF. And we've got the pineal gland. Pineal gland helps us with sleep. Okay, so don't get that confused with the pituitary gland. The pituitary gland is just behind the sphenoid sinus at the front. Pineal gland is at the back, okay, or towards the back. We come up, we know that we've got our anterior horn of lateral ventricle, posterior horn of lateral ventricle, and our corpus callosum. So corpus callosum is a big structure of nerves that deliver signal from the left to the right side of the brain. Now we've got our other little structures that we sort of looked at before. We've got internal capsule. The internal capsule is a bundle of nerves. Okay, so it's essentially just a space that nerves, the white matter tract, come through and deliver messages up and down through the brain. Okay, and they deliver messages between the caudate nucleus, which is the head there, and the tail here, and the putamen, which is out here, and the globus palatus, internal and external, which is in here. Okay, so the internal capsule runs between these structures and it delivers nerves. It's essentially just a white matter tract. Okay, of course, we've also got the thalamus. And if we go up higher, we can see there's a bit of a jump, but we can see that this caudate nucleus, it lines the lateral ventricle. Okay, so it will travel just laterally to the lateral ventricle. And its head is up the front, its tail at the back. Okay, so it travels all the way across the lateral, all the way along with the lateral ventricle. We get up to the top of the brain. We know septum pellucidum separates the left and right lateral ventricles. Okay, that you can see there. And then we have parieto-occipital fissure, the transverse sort of coronal fissure. And we have the top of the corpus callosum. Cortex, grey matter, white matter, falx. We know the difference between a gyrus or a gyrus and a sulcus. Okay, so the gyrus is the brain matter and the sulcus the actual brain, and the sulcus is the area between that brain. Okay. And the motor strip. So what's the motor strip? I'm using my motor strip to touch my fingers. Okay, so the motor strip, that's the nervous center, the grey matter in the motor strip. If I activate that, I touch my fingers. All right, any questions? Anything, anyone's got any questions? Anyone's got comments? Way I could do this differently? Okay. We're going to start looking at CT, and we're going to do those structures on CT, some of those structures. So I'm going to give you a couple of seconds each just to write down what you think, see how your memory of so far has gone. Okay. And then we'll show you the answer. So left ocular bulb, if you've said left eyeball, you're absolutely right. Okay. So, sinus, do you remember what type of sinus that is? It's the ethmoid sinus. That's the bone. So we see the bone is a little bit better shown on CT. And of course, that's soft tissue windows of CT. Okay. We know that's the external auditory canal. What's that? What's that structure running up there? It's the left vertebral artery. So we know that's run up the transverse foramen of the C-spine. And then we know the left vertebral artery runs together into the basilar artery and then up towards the brain, the posterior circulation of the brain. Any idea? That's the clivus that I was talking about. Okay. Now we know that that's a bone, and in the middle is air because it's very black. Okay, exactly the same black as out here. So we know that's the petrous temporal bones, and we know that inside the petrous temporal bones, we have mastoid air cells. Okay, And just aside for a sec, it is important always to put the side. So if someone says to you, if someone stops you in the street as you're walking the bus stop and they say, hey, what's that structure there? It's always more professional to put the side. You've got 2 mastoid air cells, and this doctor has is going to do an operation. If you just say it's the mastoid air cells, the doctor's going to go, well, which ones? Okay, so it's always professional. It's always good technique to mention it's the right side. And we're looking at the patient from the bottom, from their feet up. Okay, so you can imagine this patient is lying and you're looking at this patient from their feet up. Okay, and of course they're lying supine. So this is going to be their right side and this is going to be their left side. Okay. What sort of bone is that? It's their occipital bone. Very good. I hear everyone say. 12 is the spinal cord. You can see the intensity of that structure. So that structure has absorbed a little bit more radiation than this structure around it. Okay, so fluid. But not as much radiation, not nearly as much radiation as the bone. Go up a little bit higher. Now this sinus is just in front of the pituitary sinus, and doctors use this sphenoid sinus to go through to the pituitary sinus. In external ear canal, mastoid cells, what hemisphere is that? It's the left cerebellar hemisphere, or it's just the cerebellum. Yep, we know that. That's too easy. Easy marks. Number 9, what sinus is that? It's the ethmoid sinus and the spinal canal, or the medulla oblongata of the spinal canal. Okay, so it's that portion of the spinal canal. Okay, so we've got the sphenoid sinus again on that CT. I'm going to go through it a little bit faster because we're running out of time. I'm talking too much as usual. Temporal lobe. Yeah, ear canal, mastoid sinus, cerebellar hemisphere, ethmoid sinus. Excuse me. Now we've got the basilar artery. Okay, so we saw that we had 2 vertebral arteries here and here, and they've come together. You can even see where they've come together or how they're coming together to form the basilar artery. Okay, again, part of the posterior circulation. The bottom of the frontal lobe, basilar arteries, mastoid air cells, cerebellum, and we've got the frontal sinuses. Okay, now we didn't see that very well on the MRI because we don't see bones very well. Sphenoid sinus, sphenoid bone, sorry, and petrous temporal bone. So we see that as a bone rather than as a space, as we did in MRI. Okay, remember bones are generally dark on MRI unless they've got fatty marrow. And there's our transverse sinus. Okay, so our right, I beg your pardon, I've got it wrong. Our right sigmoid sinus. Okay, I'll go back. Okay, so we've got our transverse sinuses come across here and then turned into our sigmoid sinus and then into our right internal jugular vein. So we know the blood's come down from the brain through those blood vessels. Frontal sinus, falx. Okay, so now we've got our internal carotid arteries. So we've seen our posterior or posterior circulation, our basilar artery. Now we're looking at our right internal carotid artery and our left internal carotid artery. Okay, so that's our anterior circulation. We've got our posterior circulation and our anterior circulation. Our clivus bone. All right. So get a feel for these type of images. I'm going to race through them now because I'm getting bored. Our middle cerebral artery, we will talk about the arteries in a little bit. Okay. So again, our caudate nucleus. Okay, our head of our caudate nucleus, and we know that follows the lateral ventricle all the way through to the tail of the caudate nucleus. Okay, our third ventricle, so if we go up, we might see, there you go. So there's our interventricular foramen or foramen of Monro. Okay, so that's where the CSF obviously is formed in those lateral ventricles and in the third ventricle, and it travels down through those intraventricular foramens into the third ventricle. This is interesting. This is choroid plexus. Okay, so it's calcified choroid plexus. So we know choroid plexus makes the CSF. Okay, this is calcified pineal gland. So, and of course, when it becomes calcified, as we grow older, then we start to see it. It absorbs the X-rays in CT, and we start to see it. Okay. Septum pellucidum, separating the left and right ventricle. Same sort of structures. We've got the superior sagittal sinus. Okay, so we've seen the blood go up through the arteries. Now we've seen the blood come down again. That's our corpus callosum. And it's the splenium of the corpus callosum. So our corpus callosum travels across the top of the ventricles, and it connects the left and the right hemispheres. Okay, so this is the splenium. This is the posterior part of the corpus callosum. Then we've got the body, and then we've got the genu at the front. Okay, our falx, and of course our anterior superior sagittal sinus. More of the same structures. Probably a good thing would be the sulcus and the gyrus. Okay. So you can see those on CT. And you can see again that the grey matter, or the cerebrum, or the grey matter, has absorbed more radiation, attenuated more radiation than the white matter, than the CSF, the fluid. Okay, on this CT scan. We'll get through the facial bones and then we'll have a break. Okay, so we're going up. Obviously, we see the teeth. We see the mandible. Anterior spine of the nasal bone. Hard palate or palatine process of maxilla. Okay, so that's the roof of our mouth. We've got the bottom of a maxillary sinus. Okay, again, it's an air structure. CT, these are bony windows. Okay, so you can see the detail in these bones, but you don't see the soft tissue structures as well as we just did. All right, so we're not going to see the brain structures very well, but we're going to see the bones absolutely superb. Ramus of the mandible. The maxillary bone. We've got the maxillary antrum or the maxillary sinus, so we're going to see the maxillary bone. surrounding the sinus. Okay, so now we've got the nasal cavity, the septum, maxillary sinus. We've got just the front, what's that, coronoid process of the mandible. Okay, so we know the mandible has a TMJ, okay, condylar process, and coronoid process. We know the mandible has two processes. And then we've got the air cells in the mastoids. Go up a little bit higher through the nose, through the facial bones, and we have all the structures there. I'm not going to lay it down too hard. Apart from the maxillary bones, we've got through. We see the top of the temporal mandibular joints, okay, or the mandible, I should say, not quite through the joints yet, and the sphenoid bone. Zygomatic arch, shown really well. Okay. We're just getting into the temporal bone now. And can you see here, one thing that I like to point out is the temporal bones. The CT shows amazing detail of these temporal bones. This is a little nerve coming out. It's the 7th and 8th nerve coming out of the brain. But the CT really shows the temporal bones around that nerve well. However, it won't show a small tumour in that nerve because it's not as sensitive. Okay, whereas the MRI will show that nerve really well and any tumour in and around that nerve, but excuse me, it won't show the bones around it. Okay, so that's why a lot of patients have to have both CT and MRI of certain pathologies. Having said that, if there is a little tumour there, quite often that tumour eats away at the bone. Okay, so that's why we need a CT of the bone if there's a tumour to see whether it's, or how aggressive it is, or whether it is aggressive, because you don't see that bone on MRI scan. Okay, nasal bone, ethmoid air cells in the nasal concha. It's like a shell. I guess a concha is a shell, a snail shell, so it's like that snail shell. Okay. Again, we're starting to get to the clivus. The sinuses are obviously shown really well. And there's the structures there that you can review. Septum between sphenoid sinus. 7's the posterior clinoid process. So we know that that houses the pituitary gland. Okay, so we've got a posterior and we've got an anterior clinoid process. See how we don't see the brain in CT? There's not a lot of information in these windows of bony windows when doing CT. Okay, but then the bone is amazing. And we've got the frontal sinus and the bones. Okay, parietal bone, frontal sinus, and frontal bone. Right, okay, who's up for blood vessels? I am. But first, I'm going to give you a break. So it's 12:03. We're going to go and have a drink, have a cup of coffee, whatever. jump up and down for 10 minutes, or even better, go and sit in the sunshine for 7 minutes. That's the best, because it's spring, and spring is the best. Okay, so I'm going to stop screen sharing. Am I? Yeah, I'm going to stop screen sharing so as you can see my lovely face. Thank you. Excellent. Okay. Now we're going to start from the bottom to the top. So we're going to have a look at, we're going to just keep it quite simple. Vertebral artery. Okay, so we know that's the left and that's the right. The patient's left and right. Basilar artery. And then we have the posterior circulation. Okay, and we've got the posterior cerebral artery, and we've got the superior, posterior cerebral artery. Okay, so the posterior cerebral artery, cerebrum, and the posterior, the superior cerebellar artery. Okay. And of course the pontine arteries. So we know they come up from the neck and they meet at the circle of Willis. Okay, and then we've got the posterior cerebellar arteries. Posterior cerebral arteries. There. Okay. We know at the front we have the anterior circulation. So we have the internal, we have the right and the left internal carotid arteries. So we know we have the common carotid up our neck, we have internal that goes to our circle of Willis, and we have external that goes around our brains and delivers blood to structures like the face, maybe our ears and around the skull, meninges, I think. Okay, we have our posterior communicating arteries. Our anterior cerebral artery actually starts here. Okay, so this isn't our anterior, this is our posterior communicating artery between the internal carotid and the posterior cerebral artery. But our anterior cerebellar artery runs here. Okay, our anterior communicating artery is this little fella here. Okay, so that connects the left and the right anterior cerebral arteries. Okay. All right, and then we have, of course, we have the circle of Willis. We have our internal carotid artery. We have our middle cerebral artery. And of course, I've mentioned we have our anterior cerebral artery. Okay. So let's see how we go with those on a CT scan. No, an MRI scan. So we're going to look at it from the top. And I think this is quite difficult. All right. So we have posterior circulation. We've got the vertebral arteries, the basilar, and the posterior cerebral artery. Okay, we have our internal carotid arteries, our middle cerebral, and we don't see these anterior cerebrals very well actually on this view. These images are called our MIP images. So they're called maximum intensity projection images. Okay, someone's sleeping. That's disgusting. So what they're made up of is raw images. Okay, so these raw images show the blood vessels. We don't need contrast in MRI, but we can see that this is our left internal carotid artery. Okay, we're at the level of the nose, so we're above the common carotid artery. So it's our internal carotid artery. And this is our left vertebral artery. Okay, in fact, that's going to annoy me. So I'm going to change that. And then play it again. Screen share it. And play it again. Okay, so that's left internal carotid artery, left vertebral artery, right vertebral artery, and of course we've got the right carotid, we call it siphon, as it tunnels through the bones, through the foramen. Okay, internal carotid arteries again, basilar artery. Now there's our anterior cerebral arteries. Okay. Internal, middle cerebral artery. So we're above the internal artery, internal carotid artery. We've moved up a little bit so we can imagine there's our circle of Willis. Okay, and so this is middle cerebral artery that's going to start sending blood to the lateral aspect of the brain or aspects of the brain. Posterior communicating artery between the posterior cerebral arteries and the middle cerebral artery. Okay. And then, of course, we have the posterior cerebral arteries that receive blood from the basilar, that receive blood from the left and right vertebral arteries. Now we come up a little bit higher. We have the anterior cerebral arteries. Okay, so they deliver blood to the middle of the brain, up along the middle of the brain. Okay, whereas our middle cerebral arteries deliver blood to the lateral aspects of the brain. And there's our branches of the middle cerebral artery. Posterior cerebral artery, so that's got blood from the vertebrals to the basilar to the posterior cerebral artery. And we have what's called the vein of Galen. So that is going to drain the blood back down through the veins. And of course, we have our sagittal sinus. Okay, so that's going to collect the blood from the top of the brain. Okay, the draining veins take blood to the sagittal sinus, the superior sagittal sinus, and then it passes the blood back. Okay, so now we've got, so in CT, we need contrast to pacify these blood vessels. Otherwise, they don't absorb or they don't attenuate radiation. You won't see them very well, okay? However, when you inject radiation, when you inject contrast, that attenuates the radiation, and of course, you see them very well on CT, okay? So there's our structures there. All right. It's just the structures that we've just covered. We've seen the difference between arteries and veins. Okay. So arteries have muscle in the walls, a lot of muscle in the walls that keeps them nice and tight. Veins, not so much. Okay. So they're a little bit loose. All right. There's our carotid siphon. Okay, so we know the internal carotid goes up and then does a squiggle and comes up again to the circle of Willis. All right, this is its transverse section. And then, of course, we see the left sigmoid sinus. We've seen that again. And our basilar. That's our basilar artery. It's the part of the brain, the part of the basilar just before it enters the circle of Willis, before it goes to the posterior cerebral, is called the tip, the basilar tip. And of course, we see the sigmoid. Yeah, so it does, the opacity of the vessel does help to determine whether it's a vein or an artery. Yeah, that's really good. It's usually a lot more dense in the artery because, of course, we're injecting or the veins, the contrast is going up through the arteries and then gets a little bit more diluted before it goes to the brain, before it goes to the veins. So that's a really good point. The only thing you've got to be careful of is that if you start this scan too late, then that contrast you won't get as much in the arteries and you'll get more in the veins. Okay, so it's experience, it's looking at pictures and looking at pictures and looking at pictures, but if it's done correctly, you're absolutely right. It is a little bit, the contrast is a little bit more concentrated in the artery than the veins. Excellent. Okay, so same structures again. As we go up a little bit higher, you can see now we're above the circle of Willis. We're immediately below the circle of Willis. Okay, so we've got internal carotid arteries. All right. And branch of the middle cerebral artery. So this branch has come down to catch me. Okay. And then we've got the circle of Willis, and we've got our middle cerebral artery, of course, our left middle cerebral artery. And you can see the sagittal sinus here. This is where the sagittal sinus meets the transverse sinus. Okay, so it's called the confluence of sinuses. Okay. And then we keep going up, and we see. I'm not going to split these arteries up. Suffice to say, branch of the left middle cerebral artery. Okay, and I mentioned the anterior artery comes out at the front and then covers the top of the brain. Middle cerebral arteries, more the lateral aspect of the brain. The straight sinus, so the straight sinus delivers brain from the middle of the, delivers blood from the middle of the brain to the confluence of sinus, okay, or the very inferior part of the superior sinus, superior sagittal sinus. Okay, I think we've got a couple of slides that will show that a little bit better. And then this is the anterior cerebral artery, how it's travelled from the front through the top of the ventricles and then turns into a vein and delivers blood back down into the confluence of sinus and the straight sinus. Now we're going to look, so far we've seen that, I'm just using that for imaging, but why we don't use MRI as injecting conscious. Okay, so there's a really good question. Why don't we just use MRI for imaging blood vessels? Injecting contrast in CT scans is more invasive. Is there an advantage of using CT with contrast? Excellent question. The answer to that is the images with CT, if you have a look, maybe some of your homework, if you have a look at the images with CT, they're a lot more sensitive and they're a lot more specific, or mainly a lot more sensitive to blood flow and to blood vessels. Okay, so you'll see blood vessels really well on CT scan, and you can do your volume rendering. You get a lot more information from CT scan than you do of MRI. Okay, and that's why you'll often see that CT has a big part to play in demonstrating blood vessels. Okay, however, MRI is good. We don't need contrast, so it's about a 5-minute sequence. Okay, it's like any other sequence in MRI. It's a T1 weighted sequence, and we should see the blood vessels really well because they move. But the images aren't as sensitive and certainly specific to plaques and atherosclerosis, which is plaques, and other malformations, etc., etc. Okay, so really good question. Okay, so axial scans are really, they're the main part of, when we look at a brain, I think the doctors would spend most of their attention on axial images. Okay, so they're the main parts of the, certainly for the actual brain structure. Having said that, sagittal images definitely play a part, as do coronal images for a lot of the imaging. So whilst in the chest, we pay most attention to axial images through the chest. And in the brain, probably most of the information in the brain is axial, a lot of sagittal and a lot of coronal, whereas in the chest, you really pay attention mainly to axial images. Okay, so yeah. Temporal lobe, we can see from sagittal from the side, we've got temporal lobe, okay, frontal lobe, parietal lobe, occipital lobe, and cerebellum. Hopefully that's quite self-explanatory. Okay, of course, we just need to go through one side of the brain on sagittal, because they're identical. From a macro point of view, of course. We have the gyrus and the sulcus pretty much the same as we see on the axial. We have the grey matter, which is the cortex, and we have the white matter, which is the nervous structure talking to each other. Hippocampus is a really important object structure on the temporal imaging. Okay. And that's involved with memory. Okay. So, and it's bilateral. So you see it on both sides of the brain. We come into our choroid plexus. So we can just see our choroid plexus there. Okay. It might be calcified. It probably is calcified. We're not going to see it on MRI scans. Okay. Unless it's full of fluid, in which case we will see it on T2 weighted scans. Maxillary sinus and amygdala. You can just see it there. Amygdala is just anterior to the hippocampus, and that's where we get a lot of our feelings from, our anger. Okay, so when videos don't play on PowerPoint, my amygdala goes bing, really strong. Head of our caudate nucleus, so that's just what we call partial voluming. So it's got a little bit of that head in it. Okay, then we've got our lateral ventricle, and we've got our corpus callosum. We know delivers neural messages from one side to the other of the brain. Okay, and of course our cerebellar tonsils. So our tonsils just an extension down there in the cerebellum. Okay, if our tonsils drop too far, then we get what's called Arnold-Chiari syndrome, which is they drop down into the object of the foramen. Okay. Whoa, there's a busy slide. Okay, so these are the structures that we've seen, we've covered so far. We've got our pituitary gland, which is covered really well on the sagittal brain. We've got our suprasellar cistern, so supra, cellar, and then we know cistern's just a space. Okay, our corpus callosum, as I mentioned earlier, we've got the genu and the splenium. Okay, front and back. Frontal sinus, again, it's hard on a CT, on an MRI scan, because we get little contrast between the frontal sinus and the bone. Sphenoid sinus, we go through the sphenoid sinus to get to the pituitary, or we don't, neurosurgeons do. We've got the pons and the parts of the pons that we saw in our axials, and we've got the medulla. And of course, the spinal canal and C2. C1's just here. Okay. So these are the veins that we were talking about. If we start with the superior sagittal sinus, we've got the inferior sagittal sinus, and then the great cerebral vein, or the vein of Gallia. Okay, they pass blood to the straight sinus, which connects to the superior sagittal sinus in the confluence of sinus. Then, of course, once it does that, we have the transverse sinus, the sigmoid sinus, and the internal jugular vein. We have the cavernous sinus, which is a small collection of blood vessels that send blood back. And we have the occipital sinus. Okay, so a little bit more information. Okay, but essentially we've got the superior sagittal sinus, we've got the inferior sagittal sinus, and we've got the internal sinus. Okay. There we are there. And superior petrous sinus. Torcula herophy, or a herophily, is another name for the confluence of sinus. This is an MRI scan, a lateral maximum intensity projection. And this is just one image that's acquired along that direction. Okay. And next year we'll talk about why, and the following year we'll talk about why it's got to be oblique. But for now, that's what it looks like. So if we have a look at a slice that's off center through the brain, we can see these little cerebral veins. Okay, and that's all because blood's flowing through them. All right, and the same here, obviously. Front to back. And another lateral maximum intensity projection. Okay, so one slice, there's our transverse sinus. So we are running out of time, but we've got, obviously you'll have access to all these images. I'm hoping that I've given you I've showed a picture of the blood vessels. But if not, if you Google it, you'll be able to see how you can compare the MRI and the CT of the blood vessels, and again, you'll show that the MRI is very, the CT is exquisite detail. There's that's a good caudate nucleus. See how it runs? Again, we've only sliced the front of it, but we can see how it runs lateral to the lateral ventricle. It follows the course of the lateral ventricle. And then we come into our more sagittal CT slices. Now, we must remember as well that CT is all acquired axial, okay? So these sagittal slices are reconstructed from the very fine axial slices. Whereas MRI, and there's our detail from our CT scans. Okay, and the same sort of structures that we've done. Again, they're acquired axially, and then they're reformatted or post-processed to get their information. Okay. So now we see, I'm going to slow this down a little bit because we see really well the bony structures, and we can see how, again, these being acquired axially, they're post-processed sagittally, but you can see how well they show that temporomandibular joint. Okay, so the actual joint in there and the condyle of the mandible. All right. And then, of course, we're sagittal, so we see that airspace, and we see a great picture of the mastoid air cells. Again, appreciate that we have the different presentations. We have the mastoid air cells, the IAC, the IAMs, auditory meatus, are cut sagittally, okay, and the temporal bone, but the mandible is sort of an oblique because, of course, we know it goes at an oblique angle, okay. And there's the different bones, obviously, that you have to know, the different parts of the facial bones, or the bones, the different bones that make up the facial bones. The clivus, okay, the sphenoid bone. I just, again, I lied, I'm getting tired. The sphenoid bone, okay, and the clivus is here. Okay, so I don't think this is the clivus here. All right. And then, of course, we see the structures more in the midline. So there's the clivus. Again, the pituitary is sitting here. Okay, so we have the dorsum sellae, or the posterior, and the anterior clinoid process. Okay, sphenoid sinus, frontal sinus, the nasal bone, and the structures there you can see. The hard palate, so we can see that the tongue, the mouth, the teeth, and we've got the hard palate, and then, of course, we have the soft palate there that doesn't have bone. Okay. So now we get into the end. This is a T1 image in coronal, and we use this quite often as a different type of image. Obviously, you can see that it's a different type of image, but it's a very, very contrasty image. Okay, so you can really see the difference between grey matter and white matter, and you can see the structures in there. You can see the veins. Not particularly well, but that's the white dots there. You can see, but this is very helpful just as it's called an inversion recovery sequence. And it's very helpful to get a little bit more information, a little bit more contrast within the brain. Okay. And of course, you can see the different parts of the brain, different aspects of or the lobes of the brain. As we go through temporal lobe, frontal, we go through the frontal to the parietal, we have the temporal, the cerebellum as we're going back. We usually display these from back to front. Okay, coronals usually go from back to front, sagittals from right to left, and axials from bottom to top, inferior to superior. And now our structures, you can see how we show grey matter and white matter on these images. Okay, occipital horn, so we're at the back, and we know we're at the back because of there's the cerebellum. Okay, so we have the occipital horn of the lateral ventricle. and we're coming forward. There's the pineal gland, so we know that's at the back of the brain, just behind the top of the brainstem. We have the lateral ventricle. We have what's called the tentorium. Why is it called a tentorium? Because it's a tent. Okay, so it has a, if we have a look there, that's a tent. Okay, the tentorium separates the cerebellum from the cerebrum. Okay, and it's a subarachnoid space and meninges. Okay, so we're coming forward again. We're seeing the lateral ventricles, the third ventricle, the cerebral aqueducts. Okay, we're seeing the spinal cord. We're seeing the hippocampus in the temporal lobes. Okay. And what else are we seeing? The cerebral peduncle. Okay. So we come forward. We're going to see, there's the hippocampus and there's the amygdala. Okay, so the amygdala is just a little bit medial and very small, hidden in the hippocampus, which is in the temporal lobe. And again, of course, we see the septum pellucidum all the way through. Medulla oblongata. Okay, so we have the pons. We can see we've cut through the pons and we've cut through the medulla. And then we're coming forward, forward, out of the brain. We've got a little bit of time for a quiz. But not much. So we've got the ethmoid sinus, okay, and we can see we're coming back from the orbits now, and we can see we're going to get through the ethmoid sinus and then into the sphenoid sinus. Okay, we've got the meninges covering of the brain, separating the right from the left hemisphere, and of course we've got the superior sagittal sinus, and of course we've got the bone. We're looking at CT. This bone has absorbed the radiation. Coming back. Pretty much the same structures that we saw, okay. Nothing overly remarkable there. There's our Sylvian fissure, okay, separating the lobes of the brain. Okay, so left and right Sylvian fissure. Our optic chiasm. So we know that the nerves from the brain, the nerves from the eyes come back to the optic chiasm and then they cross over. Okay, so you can see that really well. And you can also see the left internal carotid artery as it's cut, as it's horizontal at that section, and we see it cut in that section. Okay. Septum pellucidum, left and right ventricles. Whizzing through the brain, third ventricle. Okay, so we're seeing the CSF coming from the lateral ventricles down into the third ventricle. basilar, I'm going to show you. There's our parallel slice with the basilar artery. Okay, so we can see that basilar artery coming in its length on a coronal. Much of the same structures we've been covering. The thalamus, so the thalamus sits just above or either side of the third ventricle. Okay, just a little bit more posterior underneath the lateral ventricles. Okay, and then we're going to come back towards the tail of the caudate nucleus, which we don't see particularly well in these images, but of course they're following the lateral ventricles. Okay, we see the choroid plexus well there because it's calcified. Okay, foramen magnum. Okay, between the occipital bones. And there's the straight sinus there, so blood coming down that vessel, the vein that delivers blood back away from the brain. So maybe as an exercise, you might like to write down some structures where the CSF starts and where the CSF finishes, and write down the structures between. You might like to write down the blood vessels as blood leaves maybe the common carotid artery and goes through the internal carotid artery. You could draw a little diagram to study. That might help you. So coronal, and coronal is quite important for facial sinuses, okay? Again, it's demonstrated pretty much the same, well, it is the same bones that we've looked at in the other planes, but the coronal is a very useful plane that they use in CT to demonstrate the frontal sinuses. You can see there the nasal concha, okay. We're getting back through, so there's the ethmoid air cells, and as we continue back posterior, we get towards the sphenoid sinus. And we're going anterior, so we're getting, again, the ethmoid sinus, we get the nasal concha, we'll get the nasal septum, okay. And then, of course, we have the maxillary bone there, okay. And the sphenoid bone, so the greater wing is sphenoid. TMJs, we saw them on the axial, we saw them on the sagittal, and now we see them on the coronal. Okay, so again, the 7th and 8th nerves are coming out here. We don't see the nerves very well, but we can see the bones very well around them. Okay, on CT. And of course, we see the canal and we see the mastoid air cells. Then you go and do an MRI to show those nerves very well, the actual nerves very well. So there's our blood vessels on CT. And of course, this is C+, so this is post-contrast. Okay, and you can see the structures there. You can imagine there's one vessel coming up. We're going posterior, so it must be the left posterior artery, the right posterior artery, and it must be the basilar artery. Okay. It always scares me. Okay, so we're gonna finish off we've got probably 5 minutes max. We're going to finish off with a couple of quizzes. So we're looking, so our left, we can see that you have to tell me what's, can someone tell me whether that's a T1 or a T2, or what plane is it, first of all? What plane are we looking at on our left? Anyone tell me? Is it a sagittal, a coronal, or an axial?
Is it a sagittal T1?
Perfect. Okay, so plane is the sagittal and the weighting is a T1. We know it's a T1 because the fluid's dark. Okay. What about the one on our right? Can someone tell me what plane, what weighting that is?
Axial T2.
Very good. Perfect. Okay, so, and of course they're MRI scans. Plane and weighting. So we can see the ventricles are bright.
Coronal T1.
You got 1 out of 2. So it's a coronal.
Oh, coronal T2.
Perfect. Perfect. Okay, so it's a T2 scan because the ventricles are bright. Perfect. Okay.
So is all the black space the bone?
Yes.
Okay, thanks.
This is a slightly different type of sequence. You can see that it's not as clear as perhaps this is. Okay, so this is a T2 weighted sequence again. You can see this one is not as clear, but it's still a T2 weighted sequence. Okay, it has its advantages. So you will see it a lot when you do your MRI, but yeah, it is a T2 coronal. T1 or T2? Anybody else?
Is it T1?
I asked a trick question and I was a nasty man. Anyone else? Or would you like to? This one you can see, so you can see here, it's a CT. It's a CT, yeah. You're right in that, the first girl was right in that it's a T1 because the fluid's dark, okay? If it was an MRI scan, it would be a T1. But if you have a look at it and you can see that the bone has absorbed the radiation, so the bone's bright, okay? And then of course you see the choroid plexus is bright. So those structures are calcified, they've absorbed radiation, so it's a CT scan. Okay, but that was me being particularly nasty. What about that one? CT or MRI? Anyone?
CT, because the bone's white.
No,
MRI, because there's black bits of bone and the white is the fat and skin.
Perfect, perfect, well done. Okay, so this is the subcutaneous fat. Okay, this is the bone. It's hard, I appreciate it is hard, and I think a lot of you are probably, I could imagine if I was in a lecture, I'd get eggs thrown at me. But it's just a matter of looking at the images, looking at them again and looking at them again, and it'll fall, you'll understand. Subcutaneous fat, okay, bone, and bony structure, and then of course, T1 or T2, because that's the third ventricle. Anyone?
T1.
T1, perfect, well done. Okay, so it's an MRI scan, it's axial, it's a T1, because we see that the water is dark. What do we think?
Is it a C2?
Does anyone else agree? Excuse me, disagree? CT? Yep. Great. The Cookie Monster or someone agrees? Anyone disagree? Anyone think it's something else? Taking this one step further, it's a CT scan. Is it bone window or is it soft tissue windows?
Soft tissue.
Perfect. Oh, well done. Yeah. So it's soft tissue windows, okay? We see the bone there because it's absorbed radiation, but we don't see it very well. Okay, whereas we see the brain parenchyma, the cerebrum very well. Okay, T1 or T2? Or MRI, or CT, of course. What do we think? Anyone have any?
T1.
Yep.
MRI.
Perfect. Perfect. Because the fluid in the ventricles is dark. Now we've got fluid in the veins, superior sagittal sinus, straight sinus, vein of Galen, inferior sinus, internal sinus. They're all fluid. They're all bright. That's because we've given contrast. Okay, and we've done a T1 weighted scan. So we always do T1 after contrast. We don't do T2. Contrast doesn't affect T2 as much. And we see the sinuses are always bright after contrast. We'll get to that next year and the year after. But excellent. T1, so that's a T1 weighted scan, MRI sagittal. Ideas?
CT soft tissue.
Perfect. And what plane?
Coronal.
Perfect. Okay. I don't want to hear anyone say AP, because that's what I do. It's nasty. Coronal, CT, soft tissue, windows. Oh. CT, MRI, T1, T2. What structures can we see fluid in? Anyone know
Is
what?
it MRI T1?
You got 1 out of 2?
Okay.
Yep. So
T2 then?
T2 then. Yep. MRI T2. Okay. The reason it's T2, we look at the fluid. We look for fluid-filled structures and we can see that fluid's in the eyeballs. Okay. So, okay, that fluid-filled structure is bright. So it's a T2 weighted scan. And if you remember right from the start, it's a T2 pathology weighted scan because it's T2, it's a pathology weighted scan. T2 showed pathology because pathology has fluid and fluid is bright. Okay. So it's a T2 weighted scan. We can see the fluid in the eyeballs. We can see the fluid in the fourth ventricle. Okay. And we can see the fluid around those little nerves. But this is quite a movie scan. We're probably running out of time and getting bored. Anyone want to finish off with this one?
Is this one C2?
Perfect. Perfect. And it's actually blood windows. Okay, so it's not bone windows. It's not soft tissue windows. It's blood windows to see the opacified blood vessels. Yeah, good. Another good question, Vicky. Contrast does have an effect when using T2, but only a very small effect. And we have to minimize, and we have to maximize it when we do T2. So essentially, I'm going to say, certainly at this point of your learning, no. It only has an effect when using T1, okay, or a very, very minimal effect on T2.
Just another question.
Yeah.
When using a CT blood window, do we still have to administer contrast?
Yeah, you have to use contrast? Yes, yes. If we didn't use contrast, if contrast wasn't injected here, we wouldn't see these vessels. They'd be the same intensity as the blood vessel, as the brain cells, brain parenchyma. Yeah, good one. Good question. Good questions. Very impressed. Okay. We know that's T2 axial. Okay, again, these are all different types of images. We're going to learn a lot more next year. We can see here how the blood the fluid in the eyeballs is bright, so it's a T2. Okay, a lot of people look for the fat structures and they say, well, if you can see fat, it's a T1, and if you can see fluid, it's a T2. That's not wise. Okay, it's much better to say if you can see fluid, it's a T2, and if you can see, because you can see here, this is a T2 scan, but you also see fat. Okay. There are cases where there's a T2 scan and you don't see the CSF fluid. Okay, but again, we'll talk about that. I don't present any of these images here. Okay. So in summary, CT and MRI show different structures in a variety of different ways. So we've seen how we can see bones, blood vessels, soft tissue structures and their appearance on CT, MRI, T1, T2, bone, soft tissues, windows. When learning the location of these structures, it is important to recognise their appearance on the different cross-sectional images. Okay. In order to recognise these structures, it is important to have an understanding of cerebral anatomy. I always think that physiology helps. So when you're learning the anatomy, it's good to understand what the structures do. If you understand that, you've got a much better chance of learning the anatomy. Okay. We're finishing up. Now, there's a couple of references, but of course, there's a lot of references available for these images. Just to finish up, these images that I'll be showing you, they'll be tested. They'll be tested in John's test, but also they are. We test these structures in 3rd year and 4th year as well. They make up part of your MRI exams. Okay, so really, the more you learn them in 2nd year, the less time you'll have to learn them in 3rd and 4th year. You'll just have to revise them. Okay, so that's a little kickstart for you. Otherwise, I'm not doing anything now apart from getting these uploaded and ready for you to view as a PowerPoint, so you can scroll through them rather than a PDF. So is there any questions? Does anyone, the lecture's finished and 8 people have gone already. I'm going to stop the recording.